We'll go ahead and get the afternoon session started. It's my pleasure to introduce Dr. Chris Link. He graduated from the St. Louis University of Medicine in 1987. He completed emergency medicine residency training at the Medical College of Wisconsin in 1991 and practiced emergency and trauma medicine for 18 years. In 2009, he completed a 2-year integrative medicine fellowship at the University of Arizona, directed by Dr. Andrew Weil. Additionally, he has completed advanced training in acupuncture, anti-aging medicine, functional medicine, nutrition, and both Western and Chinese herbal medicine. He opened the Integrative Medicine Clinic at Capital Region Medical Center in 2009. He is a respected educator in the field of integrative medicine. He also lectures frequently on natural approaches to optimizing health. Dr. Link completed a 2-year fellowship in functional medicine through the Institute of Functional Medicine in 2016. He is a site director of integrative medicine and residency program at Capital Regional Medical Center Family Medicine Program. Capital Region is now one of the 70 family medicine programs nationally and internationally that partner with the University of Arizona to offer this integrative curriculum to family medicine residents in training. Today, Dr. Link will be presenting on food as medicine and the management of diabetes and irritable bowel syndrome. Please welcome Dr. Chris Link.
Hello, thanks everybody. Good afternoon, can you hear me okay? All the way in the back. So nutrition for diabetes and IBS. Do you see any diabetes in your clinic? Do you see any irritable bowel syndrome in your clinic? Yeah, we all do. You know, as I go forward here, I want to welcome you. If you have, a concise question about something I'm talking about on the slide, to raise your hand, ask the question in a loud way so that everybody can hear it. I'll repeat it if necessary. I really want you to participate. It's after lunch. This is a conference for you. It's really about you guys taking something home from here that'll make a difference in your life, in your practice, and make this more enjoyable for this next hour or so here. So an overview of this talk, we're going to look at GI physiology, and we're going to talk about the microbiome. So the first 10 minutes or so, we're going to talk about some pretty cool science. Some of this you know, some of it you may not, and I think you'll be enthusiastic to learn about it. We're going to look at optimal nutrition in general, and then we'll look at nutrition and supplements specific to diabetes management. And then we'll look at nutrition and supplements related to IBS management. So we have a chronic disease crisis in the US. 50% of Americans have one or more chronic diseases. 86% of our healthcare dollars are spent on these chronic diseases, including things like irritable bowel syndrome and diabetes. And these are increasing, and I bet you've noticed this in your practice, despite the very best things that conventional medicine has to offer. Still increasing. Many are preventable, according to Dr. David Katz, professor of public health at Yale. He said many are preventable and some are completely reversible, and this includes diabetes mellitus and IBS. I can tell you that in my practice, it is not an uncommon event that people come in with medications for diabetes, with hemoglobin A1C of 7 or more, that reverse their diabetes and get off their medications, utilizing the immense power of nutrition and the immense power of the relationship between us as provider and that patient that wants information so that they can make a change. Nutrition and lifestyle plays a key role. Now this is a patient you might recognize, not specifically by name, but this is a 50-year-old woman that has fatigue, irritable bowel syndrome, some melancholy, some brain fog, some bloating, reflux, diabetes, elevated cholesterol, and arthralgias. And over the last few years, she's kind of collected a bunch of medications, some Celebrex because of the arthralgias, some Prilosec to kind of settle down the stomach issues related to the Celebrex, some simvastatin related to her metabolic diseases and her diet, some Cymbalta related to many things. The stress of midlife and perimenopause and children, and metformin because of the metabolic illness, and hyoscyamine because of the irritable bowel syndrome. So she's collected a lot of different medications. And raise your hand if you see patients like this in your clinic. Yeah. And don't you want to help them? I mean, you really do want to help them, and a lot of times you don't have a lot of time, and they come in with these symptoms that are really problematic for them and dismal, and they're not feeling good, and so you want to do some things to help them. But some of the things we're doing may not be helping them as much as we think. You know, the simvastatin, for example, may be worsening her myalgias and arthralgias. The metformin decreases her vitamin B12, which affects her mood. So there's things going on here in relationships with medications sometimes begetting more medication. So when a patient wants to see a doctor, they come in with concerns related to their heart, anxiety, depression, irritable bowel syndrome. They may have allergies, hormone imbalances, thyroid problems, fatigue, and diabetes. And what often we do is we put them in a silo because they have this problem. We think, well, IBS, let's do what we can. If we can't help them, we'll send them on to a GI doctor. And if they have some metabolic diseases and diabetes, maybe we'll send them to an endocrinologist. These sorts of things where they get sent specific to their condition. And what I want all of us to really think is, why do they have it? What's at the root of the problem? Could it be inflammation that's leading to many of these things? Actually worsening anxiety and pain? Poor diet involved, certainly. Lack of sleep, absolutely. For so many of us, you and me included. Nutritional deficiencies, poor digestion, lack of exercise. So at the root cause of a lot of those things are these sorts of issues. And at the center of many of those things is the gut. The gut, there's no question, the gut is central to our body physically, and it's central to our good health physiologically. 2016, the Clinical and Translational Medicine, this is Nature, a major journal. There is a remarkable role of the diet, the gut microbiota, and their metabolites in the pathogenesis of several inflammatory diseases. The gut and the microbiota is at the root cause of many significant illnesses, including IBS, and you'll see in a minute, also diabetes. So this is the gut. You know, we all went through our training, our physiology and our anatomy. You know, digestion really starts when you smell the bread baking, or the onions and the garlic and things cooking when you get home, hopefully, or you have to do it after you get home. And that's when digestion really starts. You start to secrete some saliva and amylase. You start maybe chewing some of that bread, and that amylase is beginning the digestion. That thought of digestion actually turns on your upper gut, some more acid production, maybe some more bile production. The liver gets activated, gets down into your stomach starts doing its jumbling and rumbling and adding some acid and some pepsin. We start to break things down. And then in the small intestine, we break things down from big chunks into the molecular chunks, the amino acids and the fats and the specific carbohydrates like glucose. And the magic of where we actually change, we biotransform all of that, is in the small intestine, where it's then absorbed, and then it's turned into the fuel for our body, for energy, and to repair. There's a lot of magic that happens in the small intestine, but these days we know that there's a lot of magic, interestingly, that happens in the large intestine. And why that is because of the microbiome. So much of those bacteria, that really, the diversity of that bacteria that gives us extra DNA and extra potential to decrease the risk of, say, autoimmune disease, or decrease the risk of cancer, or help us absorb certain nutrients, suppress our appetite. We'll talk about that. There's tremendous amplification that allows some of this magic to happen in the small intestine. You have the folds. On the folds of the intestinal lining, you have the villi, and on the villi, you have the microvilli. So tremendous surface area. But what's interesting is that finally on those microvilli, it's just one cell thick. The epithelium inside the gut, when it's finally down to the microvilli, is just one cell thick. So it's wonderful in giving a surface area to bring things in, but there's great potential for that to break down because of stress or nonsteroidals or alcohol or other things, pathogenic bacteria, that break that one cell lining down some, and it creates more inflammation in our gut, which can lead to things like more arthritis or more autoimmune disease or rheumatoid arthritis or Hashimoto's. Interesting. So you know now that the surface area of the small intestine is about the size of that tennis court. Amazing amount of amplification, huh? So the gut is the inner tube of life. And when you think about it, the outer world really traverses our body from our mouth to our anus through our gut. You know, what's inside the gut is really the outer world. And some of the things that happen, so importantly, that you bring in the good things and you keep out the bad. And what's very interesting is that part of what our gut does is it senses the outside world. And it can change our physiology by what it sees and detects inside our gut. It's the largest organ of the immune system. 70% of the lymphocytes live in and around the gut. And the reason why is because it's such a big interface between the outside world and our body. The enteric nervous system has about as many neurons as does the spinal cord. Tremendous amount. Tremendous amount. And there's really kind of a two-way street between the information of the gut, you know, when you get a gut feeling, right, and the brain. It's really, really important. And the metabolic activity of the bacteria and in the gut rivals that of the liver. The microbiome weighs about 3 to 5 pounds. And it has a tremendous metabolic activity in regards to changing, transforming molecules to make them safe for us. It's the gut, the microbiome, is a control center for the body. There's many more organisms in the gut. You know, the microbiome is bacteria, it's viruses, it's parasites, it's archaea, lots of different things, fungi, that make up the organism in the gut. And there's many more of those than there are human cells in our body. Has anybody heard that before? Can you believe that? We're really, it's true, and it's quite amazing, astonishing, I think, when you think about it. Now, even more importantly than that, is there's 100 times more DNA in that microbiome than there is DNA in our body. Okay? Why is that important? Spinach has a lot of oxalic acid in it. And you know oxalic acid can be involved in the formation of kidney stones, right? If I start eating a bunch of spinach from my garden in the weeks to come, am I going to create a lot of oxalic acid that I'll absorb and then create kidney stones? Probably not, because there's a bacteria in our gut called oxalobacter. And that bacteria regenerates every 20 minutes, can double. And if there's a lot of spinach there, within 24 hours, 36 hours, a couple of days, 3 or 4 days, there's many more of those to metabolize that oxalic acid from the spinach, so it's safe for me. There's all sorts of other examples about potential in the gut to respond to the human environment. It's a beautiful and wonderful thing. The microbiome generates hormones, neurotransmitters, inflammatory cytokines that either can turn on inflammation in the body, some anti-inflammatory cytokines like interleukin 10. It can change, these enter our circulation and they can change many things in our system. There's no doubt that the microbiome is involved in many diseases, diabetes, cardiovascular disease, the cancer, and the autoimmune diseases. It is indeed a control center. So 90% of the bacteria are either of the phylobacteroidetes or Firmicutes. It turns out if you have more Firmicutes, and if you eat a low fiber diet, you're going to have more of these Firmicutes, and you're going to have more insulin resistance. You're going to secrete more ghrelin for hunger hormone, and you're more likely to be obese. But if you eat more fiber and beautiful plants, you create more Bacteroidetes, which produce butyrate, and butyrate decreases inflammation in our body, decreases the risk of cancer, improves insulin resistance. By the food we eat, we can change the bacteria in our gut that can change the likelihood of disease in our body. We can take bacteria from an obese human being, put it in a normal mouse, and that mouse will become obese just by changing the bacteria. Same amount of food. We now can take bacteria from a lean man and put it into a man with metabolic syndrome and have that person's metabolic syndrome improve. These bacteria have great power. In my clinic, and I know all of yours, and we're going to talk more about this in a bit, patients have bloating. And it turns out that their bacteria, if there's bacteria in their small intestine, we should have a lot of bacteria in our colon. You know, the gut's about 20-something feet long, the colon's maybe 6 or 8. A lot of bacteria there, not very much in our small intestine, maybe a little as we get way, way down to the ileum. But if you have more bacteria in your small intestine, when they metabolize the food that you should be absorbing, they create hydrogen or methane. We're going to talk more about this. If they create hydrogen, it causes diarrhea. Irritable bowel syndrome, diarrhea predominant, 50% of those cases. If they have a lot of methane because of the organism called archaea, they get constipated. These bacteria affect our health and our symptoms. We talked about how the bacteria affect metabolism. We talked a little bit about brain chemistry, but it's interesting that candida overgrowth, small intestinal fungal overgrowth, sounds terrible, but it's true, and we see it all the time now. They secrete small molecules that are absorbed through the gut lining, that 1 cell thick, goes through the lymph and through the blood, to the brain, crosses the blood-brain barrier, and affects our cravings, particularly for carbs. The yeast love the carbs. It can affect our behavior and our cravings. Autoimmune diseases. I decided not to put this in the talk, but I'll just tell you real quick. Just in the last few weeks, they found a bacteria in the liver that slides through the leaky gut membrane. Remember I said it's only 1 cell thick. That goes to the liver and is involved in autoimmune diseases, and we can give an antibiotic to suppress the growth of that bacteria that's now in the liver and reverse that autoimmune disease. This is brand new, and it's clearly something that we're going to see in the years to come. If you're eating a healthy diet or you're taking probiotics, you're much less likely to get GI infections. So if you take a probiotic when you go to Mexico, because you're going to have a strong, diverse microbiome, the likelihood that you're going to get traveler's diarrhea related to E. coli down there is much lower, or Vibrio, or something like that. The likelihood, interesting, that you're going to get a respiratory tract infection goes down, not just GI. And clearly it's involved in chronic disease and cancer. So we're a superorganism. All of the microbiome in our skin, in our sinuses, under our fingernails, in our belly button, in our gut, makes the superorganism that we are. And some people ask, who's in control here? Any questions on any of that?
What you said about the bacteria in the bowel, because I remember some research somebody published once that they were talking about taking stool and turning it into a pill that people would take.
Let me address that. So she asked about, is the microbiome potentially a medicine? Can we do fecal microbiome transplants? Absolutely, positively, now we have the poop pill. We do, absolutely. You'll be glad to know that it actually has 3 different coverings on it. And we can do enemas, and we can do, and I'm going to show you one of the places we do it. Absolutely a great piece of medicine. And you know, they did this way long ago in China, that our veterinary colleagues do it with their horses. They'll put feces over a sickly baby horse because they do better. We need these. And that's why the children that are born in the operating room don't do quite as well, because they don't go through the vagina, right? Okay, we're just about done with the science here. Let me just give you some definitions. We talked about what the gut microbiome is, all of the different organisms, bacteria, virus, yeast, parasites. We talked, well, let's say what a probiotic is. A probiotic by the World Health Organization is an organism, when administered in adequate amounts, confers health to the organism. A prebiotic, and this is actually more important than probiotics, are fibers that are indigestible by the human being but provide food for that wonderful microbiome in the 6 or 8 feet of our colon. That's a prebiotic, more important than probiotics. And then there's dysbiosis, and I kind of talked a little bit about that already. Small intestinal bacterial overgrowth, small intestinal fungal overgrowth, is an abnormal array of bacteria and organisms in the gut. That's dysbiosis. Now, this is an interesting paper on the mechanism of metformin. What does metformin do? Well, one of the things it does is it increases the presence of this bacteria called Akkermansia muciniphila from about 3% or 12 to 12%. And when it does that, it improves insulin resistance. It normalizes that GI permeability, so inflammation goes down. We can do this ourselves without metformin by eating more foods with prebiotic fiber that feeds that particular bacteria, things that come from beans, garlic, artichokes, and onions. How's that? And it's interesting, as you may know now, we're using metformin not infrequently in weight loss. How do we disrupt this cherished microbiome? The Western diet that's low in fiber, allergenic foods and food intolerances, and I'll talk about those. And antibiotic prescriptions that you and I write, thoughtfully now, I'm sure, but also 70 to 80% of the antibiotics that you and I are exposed to and our patients are exposed to comes from animal husbandry and the livestock foods that we eat, the chicken and the beef and the pork. Most of it's coming from those animals to us and our patients. The proton pump inhibitor, the purple pill, is involved because, if you have low acid in your stomach, you're going to get a lot of bacteria in your upper gut where it doesn't belong. If you have a strong, pH of -1 or 2 in the gut, those bacteria that come into the gut, they're destroyed. But if they're not, they help foster small intestinal bacterial overgrowth, a bad actor. And we want to use those medications as often as necessary, as little as possible, and as short a period as possible, the PPIs. If you have patients on them all the time, there are ways to get your patients off. So we could end the talk here and say, really what you want to do for great gut health and diabetes and irritable bowel syndrome is you want to eat real food. And you want to avoid the processed foods. And there's lots and lots of reasons. Those processed foods are high in carbohydrates, they're high in preservatives, they're high in colorings, they're high in food additives, they're high in food colorings, they're high in a bunch of poor quality food ingredients. And they're high in something called emulsifier. Now, emulsifiers are a group of chemicals that liquefy, allow a fat and a liquid to stay together. So in Jiffy peanut butter, they put emulsifiers in there to keep it together. In a lot of our foods, well, it turns out there's another name for emulsifier. It's called soap. Now, why don't you want soap in your gut from all of these foods? You don't want it there because there is a wonderful biofilm that's along your gut lining that's helping to protect that one cell thick epithelium. So if you see things like polysorbate 80 or carboxymethylcellulose, read labels, and if you see these names that you say, boy, I wish I would have paid attention in biochemistry, then you shouldn't be eating them. I mean, or not very often, right? I don't have to be perfect. You guys aren't, and I know our patients aren't, but you just move towards whole food, a lot of things get better. A lot of things get better, folks, a lot. So how do we cultivate? And this is kind of a beautiful, we're kind of getting done with the science, so I hope not to put anybody to sleep on this, but this is just fabulous. So we know that one of the ways we seed the baby's microbiome is from the mother's blood to the mother's placenta, through the placenta to the amniotic fluid to the baby. Can you believe that? Does that sound so counter to what we learned in many of us anyway, vintage like me, that would be thought to be impossible that could happen. It clearly happens. And I'll show you why and how. The vaginal flora is another great place to seed. Another one is the breast milk. And what's cool about the breast milk is that in the breast milk is bifidobacteria. The breast milk is not sterile. There's bifidobacterium, that wonderful butyrate-producing bifidobacteria for the gut. And not only does the breast have the bifidobacteria, it just happens they have the miracle grow for bifidobacteria called oligosaccharides. So the mom makes these oligosaccharides that the baby can't digest, that are there for the bifidobacterium to digest, to seed the gut of that baby. Fabulous. And it's interesting that dirt's a pretty good place to get your microbiome improved. And families with pets have children with less atopic disease, asthma and eczema. Families with older brothers and sisters that may bring in a bunch of crud when they're out playing in the back have little brothers and sisters with less atopic disease. Babies sampling the environment all the time, aren't they? The airway microbiome at birth, lactobacillus was decreased at birth in preterm infants with lung disease. So if they were preterm and didn't get the lactobacillus from the mom to the placenta to the amniotic fluid, their lungs didn't develop the way they needed to if they were born early. Our results, this is scientific reports, our results taken together with previous literature indicate a placental and amniotic fluid microbiome, fetal acquisition of an airway microbiome. How do you like that? Medicine is fantastic in physiology. The things we're learning, it's just, Now let me tell you how it does it. So there's a dendritic cell, antigen-presenting cell, lymphocyte, a white cell. It kind of hangs around in the lamina propria of the gut. And it can reach its long tentacle-like arm, its dendritic arm, into the gut lining, into the microbiome, pull out its selective bifidobacterium, bring it back to the lamina propria, put it in the lymphatics, and ship it off to the breast. Or it can reach instead for a lactobacillus, and it can ship it off to the placenta. I don't think it gets much better than that. Antibiotics in infancy. Repeated exposure to broad-spectrum antibiotics is associated with early childhood obesity and atopic disease. Long-term antibiotics. This was a nursing study, the Nurses' Health Study. Thank you, the nurses of the US. It's a national treasure. That study's been going on since the 1980s. And we have providers in our community, and I bet there's some here maybe, that are part of that study. 16,000 nurses. And any of those women that were on antibiotics for greater than 2 months as an adult had an increased risk of colorectal adenoma. One of the reasons is bifidobacteria produces butyrate. Butyrate functions at the epigenome to decrease the likelihood of these adenomas. Turns it off. Now, the lady in the front asked an important question. I told you we'd get to this one. Microbiota transfer therapy. Okay, that's a fecal, we've whitewashed that. That's a fecal microbiome transplant, but nobody's going to do that. So, but you might do a microbiota transfer therapy. Alters the ecosystem and improves gastrointestinal and autism symptoms in children. How's that? There was an 80% reduction in GI symptoms. Children with autism often have bloating and gas and constipation, don't they? Those were improved. That was good. But there was also a significant improvement in their autism spectrum symptoms with a fecal microbiome transplant. This is going to continue to increase. These are done in major studies. These are not done at clinics like mine. These have to be FDA approved and appropriate studies to do this, but they're starting to. I'll just say something about chronic low-grade sweeteners. 1,500 adults over 10 years. The non-caloric sweeteners altered the microbiome, increased the likelihood of that dysbiosis, abnormal bacteria, and increased the likelihood of abnormal metabolism and obesity. Don't think that artificial sweeteners are good for your diabetic metabolic disease patients. Okay, I'm going to leave that there. We're going to go into optimal nutrition, and I can answer a question or two if somebody would like. There you go. So we're talking about artificial sweeteners. Not all of the information's out. The question is, what about xylitol or erythritol, which is a sugar alcohol? What about stevia? That's natural. It comes from a plant. And I think that all of the non-caloric sweeteners lead to some problems in the gut, and it leads to some problems in the brain. You give the tongue something sweet, it's expecting calories. And when you have those, you likely go on to have more because you're going to be looking for it. I can't tell you all of the data's out. I will tell you that I think it's something that you negotiate with yourself and your patients, whether a little bit of that's okay. It may be better than other things. But, maple syrup comes from a plant. And, beet sugar comes from a plant. I'm not saying not to use it. I'm saying use your judgment. Know that it's not a free pass. Another quick question if you have anybody? Go ahead. Was it you? No? Okay. All right. This is a middle-class American family. And this book is a list of, it's a group of pictures from what a family ate from around the world. People in Somalia and Germany and Japan. And this is a typical middle American family. It was a lot like my family when I was growing up. And you have a hard time finding too much whole food there. There's a few things. I see some grapes and some tomatoes. But most of this is processed food. I mean, this is a healthy appearing family, and they're doing the best they can. But we've been snookered by the commerce and the power of big food. Most of this is not food. It's food like food, with artificial crunch and just the right salt and just the right sweet and just the right stuff to get us addicted to it. I hope I'm not seeming over dramatic. This is just real. Yeah. From 1960 to past 2000, the percent of fat in our diet went down from about 43% to about 33%. At the same time, obesity has risen significantly. Fat goes down, obesity goes up. Dietary fats are generally not the cause of obesity. It's the processed carbs. This is a tenet. This works in my clinic day after day after day, and it will help you as well. Dr. Walter Willett is the world's most respected nutrition scientist out of Harvard, and he said this: white bread, white rice, white pasta, potatoes, sodas, and sweets make up 30 to 40% of calories in most diets. And there is absolutely nothing good about it. It leads only to harm, to weight gain, to diabetes, to coronary heart disease, and to cancer. This is the man behind the Nurses' Health Study, the most cited nutrition expert in the world. Processed carbohydrates are on the left. Clearly you want to stay away from those. And instead you want to add the whole food carbs, the lentils and the whole grain oats and the kale and the sweet potatoes. Those are delicious and they're great. Dr. Willett goes on to say, Choose a wide variety of vegetables and fruits. Don't include potatoes as a vegetable. Go easy on the fruit. So we should be saying, let's eat a bunch of vegetables and fruits. So go easy on the fruits that are higher in carbs, oranges, bananas, apricots, and simply avoid fruit juices. Why? Because it's just like taking IV glucose. What do you do? What do you do if you come across a diabetic in an acute hypoglycemic reaction? Could you give them some juice? How long does it take for them to come around? I see it in minutes, and I've seen many in my career in emergency medicine. So let's look at processed. So you know that this is a heart-healthy food here on the left, right? Well, if we instead eat it in the whole farm, a steel-cut oat, it is a heart-healthy food. But on the left, that steel-cut oat it's ground infinitely into powder. So when that powder hits your mouth and the amylase enzymes in your saliva and then swallowed to your stomach, it is instantly, that carbohydrate is instantly glucose, 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 glucose. That's what it is. It's sugar and it has a high glycemic index. When you eat foods with a high glycemic index, you have a big bump in your glucose, rapidly a big bump in your insulin. That insulin spike actually brings your glucose down lower than baseline within about 90 minutes. So that's the child that had, a toaster strudel and, some chocolate milk for breakfast. Something that that was there and ready for him. 9:30 he's in math, and he's fidgety, and he's looking out the window because his glucose is now down, and his stress hormones like cortisol and epinephrine are coming up. He can't focus because of this sort of problem. A whole food diet makes a big difference in my ADHD kids. I feed them dinner for breakfast. They get protein, they get fat, they get a little bit of fruit possibly, they get a real meal. So what happens if you give somebody a low glycemic meal like that? Vegetables and fruits and beans and nuts, meats and fish. You never get much of a glucose spike. And wonderfully, you don't get much of an insulin spike. And what we know is that insulin is detrimental for brain health. Insulin, hyperinsulinemia, that happens with our diabetic patients, type 2, they have a significantly increased risk for dementia. Insulin is part of that. Read labels. This is big. This is really something very important for you to teach your patients. So these are those peanut butters, and I have to take my jacket off. Forgive me, folks. I'm a little hot here. I don't want to lose anything. So on the left, you can see the proprietary one, and it says roasted peanuts, and its second ingredient is sugar. Oh, a little further down is fully hydrogenated oil. Well, this is kind of an emulsifier-like thing, and other vegetable oils and mono and diglycerides and salt. But if you read the label and you get the one on the right, its ingredients are peanuts and salt. Excellent. Much different. And nuts of any kind are particularly helpful for us in regards to cardiovascular disease and cancers. Nuts of any kind. The reason we have 56 names or more for sugar is so that we can hide it in our foods. So if you separate sugar into 2 or 3 different ones, you know how you have to list by the most volume in the ingredient, so that one was peanuts and then sugar. But if you split sugar up into, say, molasses, into corn syrup, into galactose and caramel this, now none of those are large enough to come up to the second or third. They're down here, but yet you still have plenty of sugar in that. So what not to drink? You just don't want to drink. You just do not want to drink your calories. There's just no reason for it. If you were to start out with an orange juice for breakfast, kind of a mocha on the way to work, maybe a soda with lunch, a drink later in the afternoon, say a sweet tea when you get home, and a beer watching the ball game, you could get 1,500 calories from liquid. And that's all many adults need, right? Michael Pollan, you probably know of him. He's a fabulous food writer, and he said eat food, not too much, mostly plants. That's just real important information there. And I want you to take this home with you too, if you would. This is about these 4 specific ingredients and what they do to health. I ask my patients every day to have 1 serving of greens, 1 serving of berries, 1 serving of nuts, and as much olive oil as they can use. And they will lower their risk for cancer, diabetes, osteoporosis, dementia. They'll change their cholesterol. This is great medicine because instead of saying, I don't want you to eat this and don't do that and Dr. Link says don't have any of this or that, make it simple. Say every day, try to get 1 serving of these in and you'll absolutely improve your health. CRP goes down, cholesterol goes down, triglycerides go down. It's a real powerful intervention. So summary, the foundation of whole food nutrition is vegetables and more veggies. Beans, lentils, and grains in their whole form. Fruits, but less if you're diabetic. Meats, fish, poultry, and eggs. Whole fat dairy. Women that eat whole fat dairy have less trouble with infertility. They gain less weight. Why don't you want other kind of dairy? Well, partly because when they take out the fat, the sugar content goes up. When they take out the fat, they put in carrageenan and other thickeners and whiteners and other things like that. The aqueous portion of milk has the hormones, interestingly, that come from the cow, like the bovine growth hormone and other things like that, more in the aqueous than the fat. So if you get the skim milk, you get more of that. If you like yogurt, get plain yogurt, put your own berries in it, and have a fabulous breakfast with that. Put some nuts in there too, and you have a super breakfast. And if you really want to go for it, put some no, we'll skip the spinach. Nuts of all kinds, olive oil. I want you to take this home with you too, because this is also very important. The way you use olive oil is it goes on your table, and you pour it on your food. You pour it on your salmon, you pour it in your soup, you pour it on everything. That's how they use it in Europe. And in the very famous Predimed study, people that ate an additional 4 tablespoons of olive oil a day, compared to a standard Mediterranean diet, the best diet on the planet, had 30% lower cardiovascular disease. And they had 50% less invasive breast cancer. So where does it belong? It belongs in our food all the time. You can cook with it, but don't burn it, don't smoke it. A little bit of sweets down at the bottom of the pyramid and a tincture of love, and we have a wonderful. Now we're gonna move into the discussion on diabetes. This is CDC 2017. 100 million Americans, that's about a third of our population with diabetes or prediabetes. The 7th leading cause of death, $250 billion a year on diabetes care. I had to look that up. You know how much $250 billion is? It's a lot of money. I mean, when you look at our gross domestic product of $20 trillion, right, it's about 1/80th of all of the dollars made in the US every day. 1 out of 80 goes to diabetes care. You want to know something more horrifying though? 1 out of 40 of those dollars go to dementia care. This is an overview of what we need to do for diabetes management type 2. Notice that limit processed carbs at the top. This is absolutely the key. Exercise, and we're going to talk a little bit, thanks you so much. We're going to talk a little bit about each of these things in a little bit more depth. Exercise, and then exercise immediately after eating based on a University of Missouri study a couple years ago that I'll share with you. Meal timing and time-restricted eating. I'm going to talk to you about the wonders of this, and then we'll look at some of these supplements. Type 2 diabetes is insulin resistant. You guys ever check fasting insulin levels? It's something really interesting to check. Many of my people that have, they kind of look like they might have metabolic syndrome, but their A1C is 5.5, their insulin level may be 30 because their pancreas is just chugging out insulin to keep it right. Then I have some people that are getting that hemoglobin A1C of 5.9, 6.3, 6.8, and still their insulin is 30 or 25, and their body's just not responding to that insulin anymore. That's insulin resistance. But those people, and this is why I check the fasting insulin level, because if they come into me and they have an insulin of 25 or 27, I know I can turn them around because their pancreas is still there and doing the job. And if I get them get them on the right foods and off the wrong ones, get them exercising, something can make a difference. So the standard treatment we're taught is to moderate carbohydrates with diabetes and recommend maybe 40 to 60 grams of carbohydrates per meal, right? A gram of carb is about 3.4 calories, so that's a couple hundred calories per meal of carbs, of sugar, right? The optimal treatment is to limit carbohydrates, and let me show you the data. I ask you, if you're interested in this, simply Google Dr. Sarah Hallberg, Purdue University, reversing type 2 diabetes. This is exactly what I do in my clinic. And this is some preliminary data from a recent work. This was 10 weeks. 10 weeks. The intervention group was told to lower their carbohydrates to 60 grams a day, not per meal, and then told to eat when they're hungry, don't worry about the calories. Eat when you're hungry. That would make it pretty easy for a lot of people, but just lower the carbs. In 10 weeks, their hemoglobin A1C went from 7.6 to 6.6, 10 weeks. And almost all of them were down at least one diabetes medication, 10 weeks. She reports that the one-year data will be soon soon being published, and she says that the results at 1 year are excellent. I do this every day, including today in my clinic. Absolutely use low carbohydrates. I teach people to stay off the breads, the cereals, the sweet fruits, the pastas, and they make a huge difference, and they come back and they feel better, their labs are better, and I usually get a hug or two. Really, and you will too. It really works. So cut the carbs, particularly the processed carbs. The foods you want to eat is non-starchy veggies, plenty of nuts, healthy fats, meats and fish, fruits, primarily berries because they're low carbohydrate and nutrient packed, beans and lentils. Avoid the processed grains, breads, cereals, sugary drinks, starchy tubers, potatoes, sweet fruit, bananas, and grapes. This is what it looks like. I think pretty delicious. About 25% of the calories from protein, lots of healthy fats, avocado, olive oil, coconut, maybe some bacon once in a while. I mean, it's certainly not a health food, but you can do that. And then less carbs. And for the healthiest diet, it's not, cheeseburgers and bacon and beef. Most of the volume of the food are those fibrous vegetables. Broccoli and cauliflower and kale and leeks and chard and collards and every other one like that. Lots and lots and lots of those. Please.
Have to get to the nitty-gritty of each when you're talking to these people, or do you more generalize?
I have a couple handouts that give them that information specifically. I tell them to go play with Dr. Google and say how many carbs are in that apple and that banana, and I say try to keep your carbs to about 60. So I don't get down to the specific this or that. I give them the basics. And generally, and I'm just going to be blasphemous here, I don't send them to dietitians because they tell them 60 grams per meal. They need to catch up a little bit here, and it takes some time.
I have had several diabetics recently that they eat one time or two times a day, when in reality they maybe eat starting at maybe 2 o'clock in the afternoon because they're so full from the night before, because their second meal of the day starts at 6. I want you eating, because I'm trying to reverse habits on these
We're gonna get there, and I have a great study for you on that and some information. So the question was, what about meal timing? Does it make a difference? And the answer is, it makes a fabulous difference. And eating after dinner is a major no-no. It's like for girls, if they're out after midnight, nothing good happens. If you eat, if you're eating after dinner, it's not. And there's many reasons. Yes, one more question, please. Fabulous. So what she said is that cardiologists use this too, that they use some tools like MyFitnessPal, which I absolutely love. And it's not only the patients that don't get this. I didn't get it until I put my food into MyFitnessPal, and I realized those cashews I were eating, yeah, they're good, but they also have a fair amount of carbs in them. So you have to measure, because we're pretty good at sneaking in carbs, not necessarily volitionally, but kind of surreptitiously, that your body just, and you have to measure, you have to know, you have to do at least for a while. So exercise. Move most days, walking is fine. Doing some strength training is good too. But before I go any further on exercise, by far, the big deal here is the low-carb diet. Exercise is wonderful, I want them to do it, but if they're in a wheelchair, they will get better if they use a low-carb diet. The exercise improves insulin resistance, and it's a combination of both strength training and walking or other aerobic activity. This is walking right after the meal. It significantly decreased the postprandial spike, and that's the study that was done at the University of Missouri. It cut the 10 minutes of walking right after a diabetic ate, cut the postprandial spike in glucose by 50%. That's huge, huge. Resistance training does the same sort of thing. This is hot off the circuit in the press. This was actually described at the Endocrine Society meeting March of 2018. Meal timing, so this is to get to your question here. Meal timing, more important than calories. In group 1, they allowed them to eat 6 meals a day. In group 2, 3 meals a day with a large breakfast and small dinner. Over this 12-week period, group 1, they had the same amount of calories, lost 3 pounds. Group 2 lost 11 pounds. So one of the things that keeps your patients doing this is if they have success, right? They see their hemoglobin A1C, they see themselves feeling better, different in the mirror, better on the scale. Wonderful research out of Tel Aviv now. Our body metabolism changes throughout the day. A slice of bread consumed at breakfast leads to a lower glucose response and is less fattening than an identical slice of bread in the evening. Meal. This fabulous idea that is gaining an amazing amount of traction. It's called time-restricted eating. And you fast overnight 13 hours when possible, and you particularly fast 3 hours before bed. Makes a big difference. So you might have your first meal at 8 a.m., your last meal at 7 p.m., and then you're in bed by 10. And you can shift this a little bit depending on when your bedtime is. If you do this, your metabolism improves, you lower cholesterol, you lower blood sugar, you enhance fat burning, and it leads to nutritional ketosis. And we're not talking about diabetic ketoacidosis, we're talking about fat burning. Fat as a fuel, okay? This is exactly what you want. And I just want to tell you, by the way, in the Journal of the American Medical Association Oncology in April of 2016, there was a study out of the University of San Diego where they followed a group of women with breast cancer survivors. Half of them did the time-restricted feeding over a 6-year period. The other half did not. They were not told what to eat, but just asked them to do it, and they asked them to do it 5 nights out of 7. There was a 36% decreased risk of recurrence of that breast cancer in those women with this powerful intervention. Shut the gut down at night. Let your liver do its thing. Let your upper gut clear. Let your inflammation go down. Fabulous, fabulous, fabulous. I love when the science clearly shouts to us that food is medicine. Treating diabetes supplements. Apple cider vinegar, 1 tablespoon with meals, maybe on your salad, maybe in a little bit of water, if you can tolerate it. Actually slows down the enzyme amylase, so it doesn't process the carbs as well, and you don't absorb as many. It's safe. Alpha lipoic acid is another supplement, 300 milligrams a day, and it helps with glucose transport into the cells. Berberine, it's not so much I think that you're going to go out and use these necessarily, but your patients will be looking and reading and thinking, and they'll be asking you questions about these. Berberine comes from the plant golden seal and Oregon grapefruit, and 500 milligrams a day lowers cholesterol. It works a lot like metformin and helps with glucose transport. Chromium, 800 micrograms a day, helps with insulin. Helps insulin work better at the cell so it can turn that key. Vanadium, 50 milligrams a day, helps with glucose transport. Cinnamon, 1 to 3 teaspoons a day.
How do you, other than taking that pill, how is that transport?
Yeah, I don't know. I mean, some people put it on their steel-cut oats. Some people put it in their smoothies. So it's a little bit of a challenge when you get up to 3 teaspoons, and you can get in. I use a supplement that has it in there that makes it a little bit easier for them. But that's a challenge, you're right. And Gymnema is variable dosing depending on how it's extracted, and it decreases carb absorption and increases insulin release. All of these are commonly used. I use many of these to support some of my type 2 diabetics. I'm recording this talk for you, and I'm going to put it on my website in the next couple weeks, and you will have that available to you. So I want to let you know it's drchrislink.com. And if you're interested, I have other talks on there. I have one on brain health. I have several different talks on there that may interest you. One of the things, I'm an older doc now, and one of the things I get to do is practice and do more of what I want to do, because I'm not so confined economically, and I'm not so confined as a young doctor being kind of shepherded and told what to do. I like to teach. I teach residents. I teach my staff. I teach everybody in my clinic, from the person that answers the phone about this process to my nurse practitioners, which we have 2 in our clinic. And actually, one of them's here at this conference today. I don't think she's in here. She's heard me speak too many times already. DR. Yep. Irritable bowel syndrome is a common chronic disorder, mostly in women, that significantly affects quality of life. You know that, don't you? You know how it affects the quality of your patients' lives. Cramping, abdominal pain, bloating, gas, diarrhea. Most of these people know exactly where each bathroom is between their home and where they work, and other places. And these are some of the causes of irritable bowel syndrome. Processed foods, post-infectious, FODMAPs, we're going to get into that in a minute, very important, food sensitivities and stress. And then there's small intestinal bacterial overgrowth, and there's small intestinal fungal overgrowth. Treating irritable bowel syndrome, this is an overview of what we're going to talk about in the next few minutes. Start with quality whole food. Do a 24-hour diet recall with these people. Many of them are eating poor quality food, and if you just make that change, they will get better. You know the program, the Whole 30? If you don't know it, look it up. It's a fabulous program for somebody with irritable bowel syndrome. It basically gets them off processed foods and sugar and added sugar. You got to look and remove food sensitivities. You got to know about FODMAPs. This is something important, and we'll look at this more carefully. You need to think about meal timing. It turns out that irritable bowel syndrome with diarrhea is significantly improved with 3 hours of fasting before bed. So that diarrhea in the morning that keeps them from being able to get to work on time or whatever, you have to treat dysbiosis at times, abnormal collection of bacteria, often in the upper gut. And then things like probiotics and peppermint and magnesium are great tools. There are others. And then exercise and relaxation. Irritable bowel syndrome is a big deal. I spend every day with a patient or two with irritable bowel syndrome. The question was, is how much magnesium? And let me answer that in just a few minutes because I have a slide. I'm not sure who asked it, but So it's kind of the same thing as I said before. Eat whole food. Get rid of this stuff. This is food like food. This is an important study, British Medical Journal, out of Yale University last September. A blinded randomized trial where they looked at a test called the ALCAT test. ALCAT test is about $300. It's not paid for by insurance. And it uses that person's leukocytes, and it sees how that person's leukocytes responds to a variety of different foods. Okay? Using that data, that food sensitivity data, they improved the global improvement score, they decreased the symptom severity score, and they decreased inflammation. Isn't that interesting? Inflammation. So sometimes when I have that woman come in and say, you know, God, my hands hurt, and they're a little knobby and they just hurt, I do some food elimination because I know it's going to lower their inflammation. Because some of that food sensitivity is causing gut inflammation. And those gut bacteria and those white blood cells around the gut discharge cytokines that cause inflammation in the body, maybe the hands, maybe causing headaches. This is important. Conclusion, elimination diet guided by this leukocyte activity test reduced symptoms of IBS. So not everybody in my clinic, nor yours probably, can afford the $300 ALCAT test. So what can you do? You can do an elimination diet. And by the way, that's what the Whole30 is. You get off the grains and the dairy and the sugars for 30 days. But you might eliminate wheat, dairy, egg, sugar, soy, and processed foods. People get better, and when they get better, you put things in slowly. And you see, so get them better after 6 or 8 weeks and get that hug when they come back. And they'll say, you know, I really want to put some dairy back. Okay, so try some cheese. See how you do with that. Do it for a couple weeks. See how you do. And then you can continue to add things back and see what is the key factor for them. This is a very effective, very important tool that's now used internationally in functional and integrative medicine with great power, great success. I see it happen all the time. And it's right at your fingertips. You can use it. I would test for celiac in anybody that has symptoms from here to their feet. These days, it's less likely for a celiac patient to present with GI problems than it is to present with other than GI problems, anemia and fatigue and headache, and eczema and psoriasis and autoimmune disease. And even if their celiac test is not positive, there's a group of people that have non-celiac gluten sensitivity, probably 6 to 10% of the population. 1% has celiac, 6 to 10% has non-celiac. This is about the meal timing. Fasting 3 hours before bed decreases next day diarrhea episodes significantly in IBS diarrhea. This is a very important health tool. These are the FODMAPs. Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Things that ferment easily in the gut. That's what these are. And that's why things like some of the alcohol sugars are problematic. Wheat is a big FODMAP. Why are FODMAPs a problem? Because the bacteria creates gas and other metabolites when they metabolize these FODMAPs, draws in more water, more gas, and they become, the bowel distends and they have visceral pain and cramping. Very common, and I want to show this is Dr. Peter Gibson. He's the world's expert on FODMAPs. He's out of the University of Monash in Australia. And he's got a great YouTube video, and you could simply Google Dr. Peter Monash or go to YouTube and you will find his lecture. It is absolutely fabulous, and it will change the way you treat people's gut problems. Now, do you know anybody like this? You know, when I worked in the ER as an emergency physician, people would come to me and they would say, I want to make sure I'm doing okay here. We're getting towards the end here. They would say to me, you know, I start out okay in the morning, but by 10 after I eat breakfast and by 2 after I eat lunch, I'm 5 months pregnant. And I'd think to myself as kind of a, smart whippersnapper, ER trauma doc, what? Really? And then you're in the ER for that? It's true. And what that is, when patients tell you that, when they use the term bloat, and their belly bloats and it gets worse during the day, they have small intestinal bacterial overgrowth or small intestinal fungal overgrowth, or both. I mean it. I see it, I treat it, I see it improve all the time, So what happens? When these bacteria in the upper gut, they produce hydrogen or methane, and I can test that in their breath. Because that hydrogen and methane is absorbed through that epithelium into the blood supply and is discharged through the exhalation. I can measure that. I do that all the time. But you know what? You don't have to spend the $200 to measure that. If they come in there and tell you they have bloating and chronic constipation, they probably have methane-producing bacteria that cause constipation. If they come in there and they tell you that they're having chronic diarrhea and bloating, they probably have hydrogen-related small intestinal bacteria. Some of you have heard of this, some of you have not heard of this. This has been in the New England Journal since the year 2000, folks, 2000. It takes 20 years to get this stuff into medicine. This is something you want to learn about, take home, help your patients. There's this whole group of patients that we've said, okay, we'll try some cyclamine, try some icosamine, try this, try some low modal. These people have an actionable condition that we can help improve. What are some of the medications? Rifaximin treats IBS diarrhea predominant. Neomycin, low dose, 500 milligrams BID for 2 weeks, treats methane producing from archaea. Metronidazole is sometimes used, sometimes I use fluconazole. I want to say just a few words about probiotics. Probiotics, the number needed to treat for IBS is 4. The number needed to treat for primary prevention of a myocardial infarction in a woman with a statin is well over 100, if not 500. Okay. This is about the methanobacter. Methanobacter is archaea that produces methane. It turns out that probiotics can suppress the growth of those methanobacters. Just a good, healthy, broad spectrum probiotic. I'll show you what I mean by a minute. Probiotics. Usually want to use combination strains with both lactobacillus, bifidobacteria, and sometimes Saccharomyces as well. I like one that has all 3. Can't always find that. The dose is 10 to 30 billion units. There's 100 trillion bacteria in the gut, so 10 to 30 billion is really not all that many, although it sounds like a high number. You mostly take them with meals because the pH in the stomach's higher after you eat because you've you've improved it, you've neutralized it some. That's a great time to take probiotics. But they can take it any time as long as they just take it. And if you're going to give them antibiotics, give it several times after. And by the way, you can significantly decrease antibiotic-associated diarrhea with probiotics. If I put somebody on doxycycline or amoxicillin, they get probiotics day 1. I have much less, including C. diff. These are some important probiotics that are available for you. Align is Bifidobacter infantis. It's the most gentle, just 1 billion, very well tolerated. Culturella is lactobacillus plus a prebiotic. Florastor, all of these are over the counter, is Saccharomyces, a fabulous probiotic. And then there's VSL3, which is a mega probiotic that's like hundreds of billions of units, okay? Magnesium, to answer your question about magnesium. Let me just get down to the bottom here. This is a tool that everybody should have because it's very safe and it makes a huge difference in constipation. I can't tell you how many patients in the last 10 years I've made much happier with magnesium citrate in capsule. It's about 120 milligrams per capsule. I tell them to take 1 or 2 twice a day, but they can take up to 3 or 4 twice a day. I say regulate that based on your bowel movements. Absolutely safe. You're not going to make them toxic unless they have renal failure. Regulate it, you're going to make them happy. They can start at night, but it's up to 8 a day. Up to 8 a day. You can feel comfortable and safe doing that. Have you heard about vitamin D? It turns out that vitamin D also decreases IBS. So if somebody comes with IBS, check their vitamin D level, get it at an optimal level, their symptoms may improve some. January 2018. You know that vitamin D makes a difference in bone health, brain health, cardiovascular health, immune, the likelihood of getting infections. I'm going to come back to our patient. So this patient with fatigue, melancholy, brain fog, bloating, and reflux diabetes, elevated cholesterol, we asked her to go on a, work with me here, a whole food diet. We pulled out some of the wheat and the dairy for a while. We had her implement some time-restricted eating. We had her just do some walking. We had her come back, we rechecked labs. They were so good that her drugs almost went away. She's still on a little bit of Cymbalta. This is a real patient in a real clinic that you see every day that wanted to get better, and they came to their trusted provider, and we were doing our best to try to alleviate her symptoms. But we went maybe too far down the pharmacological road, and we didn't use the power of food as medicine. And I'll leave it there. It was a pleasure to speak today to you. I hope you enjoyed it.